Hi, my name is Dorothy Ngama. I'm a nurse midwife, a unionist, an activist, and one who has worked for the Nurses and Midwives Organization of Malawi. This is a union for the nurses and midwives, and it's the union, the only union for healthcare workers in the country. For the past 10 years, I founded this nurses organization, which had been an association for many years. And the reason that I chose to work on it and convert it to a union was that as a grouping, we needed to work on the many issues that affected the nurses. And 10 years ago, one of the major concerns of the nurses and midwives was the high infection rates of HIV and AIDS. The number of nurses that were dying without care in our hospitals was very high. We were losing about 6 to 8 nurses every month. We were burying them. And that time I was teaching in the University of Malawi at College of Nursing. And it's an issue that concerned me as a nurse leader and working within the association. Therefore, I chose to retire from the university so that I could work full-time to take care of these nurses, to support them. And I fundraised to develop a program which was which we called Caring for Caregivers. This was because we realized the caregivers were losing out on the aspects of care which was available to the community. There were drugs available, support was there, but it was the healthcare workers taking care of the community. But they too were affected, infected, they were sickly, they were bedridden, they were dying without care. And therefore, I mobilized the nurses, developed this project of caring for caregivers, which included caring of the nurses, midwives, clinicians, and other healthcare workers. And we did this by providing resources for training the nurses and midwives, encouraging them to work in groups, developed support groups so that they could help each other, support each other socially, spiritually, and economically. We mobilized resources so that they could start small activities that could mobilize resources and therefore use those resources to help those nurses and midwives and other healthcare workers who were down, were not able to work, and were not getting that support they needed. Most importantly, the spiritual support was not there. So mobilizing them was to look at what they had within them. There were some who were strong spiritually who could support others. Some who were strong economically could also support others. We had situations where, for example, a healthcare worker would be very sick and weak at home. Maybe the spouse had already died and they had nobody to look after them. So these support groups, we built within that care and support. It included nutritional support. So they worked in their groups to make sure that they cooked food for each other, especially those that were bedridden. If they were in hospital, provide the care and support, spiritual support, pray for them, encourage them until they got well. And another major important area was if they saw a colleague who was sickly and maybe was not accessing the proper treatment, to get near to them, help them, talk to them, hold their hand, give them moral support, and take them to the clinician or the doctor to make sure that they were tested. And that was very important, and that is why from 8 years ago, we were burying about 4, maybe 6 nurses and midwives every month. To date, as I'm talking now, we are losing maybe 2 nurses or 1 or none every month. So far since January this year, we've only lost about 5 nurses compared to, that's 5 nurses in 6 months, compared to losing about 6 nurses every month. It's been a big difference. And this is a great achievement. As a union for nurses and midwives, we are very proud of that achievement. We know we can get better, and we're looking to a time when actually for us our loss will be zero. We want to make sure that every healthcare worker who is infected must get treatment, must get supported. They must get well and go back to work and help the sick. And this is important for Malawi because as a country we have too few nurses and midwives and clinicians. We can't afford to lose even one. Every skilled worker counts and their life must be saved. We have resources, we have capabilities, we have the knowledge, we have the drugs. What else would we need? I think we have done very well so far, but I think we cannot stop until the loss is zero. Thank you.